What is the real truth about axillary breast augmentation?
Hi, I'm Dr. Joe Gryskiewicz, and I'm a board-certified plastic surgeon. They usually call me Dr. Joe or Dr. G, and I'm going to talk about the real truth about axillary breast augmentation. You know, in my practice, approximately 80% of patients have the anatomy that allows them to pick whatever the 3 incisions they want, whether it's axillary, meaning armpit, or around the nipple, or underneath the breast in the breast crease. Now, out of those patients, the 80% that have normal anatomy, 99% actually don't want a cut on their breast. And so most of the patients that come in the door to my practice want the armpit or axillary incision. Now, there's some things that go on about that procedure, you know, in terms of, is it a lot trickier, is it a lot harder? Why doesn't everybody do this procedure? And a little bit of that is regional. You know, some areas of the country, they predominantly do the armpit incision, but around the Midwest area, not too many people do it, and it is more challenging. And it's a trickier procedure for the surgeon. And of course, I've done a few thousand of those, and I published on that in our journal, the Aesthetic Surgery Journal, and I measured patient satisfaction with the Gryskiewicz. We looked at 2,000 axillary breast augmentation patients, and then the Gryskiewicz measured their level of satisfaction. And if you want to see the article, you can go to my website, and in the first paragraph you can click on this link. But basically they measured how happy people were with their augmentation, and it showed that it was all in the 90 percentiles for satisfaction about their look and about the implants themselves. Now, we want to sort out people that have a little bit of sag to the breast, because that would disqualify them from the surgery. We have them try on different implants in their bra. We very carefully assess if there's any size difference, and then I've got some pictures that actually show about the surgery internally. And we've got 2 patients that you'll see referenced on the video itself doing their arm exercises, because we use the quick recovery approach. So they've got the armpit incision, little teeny incision, and under the armpit area, and then some pre and post-op results. And then if you like statistics, well, then you can see all their happiness levels and so forth. But I'll tell you, one of the myths about the axillary breast augmentation is that not only is it trickier, but it can have a higher infection rate. That's what's false. In fact, this is from the Aesthetic Surgery Journal, which is a peer-reviewed scientific journal. This is not a gimmick, and it shows the different infection rates and the amount of bacteria in the breast area where you make the incision. And the highest is actually around the nipple. And then down below the breast is the crease area, that's second, and then the armpit's third. So if anything, the infection rates for the armpit area should be lower. And in my series of 2,000 patients that I mentioned, it is pretty much lower. So you can see that there's some myths going around about the surgery, but like I mentioned earlier, basically, you can just, you know, pick your incision if you have normal anatomy. We're here to help you and do whatever you want. And now you can see a couple pictures of patients doing their arm exercises 24 hours after the procedure, because we use the quick recovery technique with our axillary breast augmentation, whether it's saline, meaning salt water, or silicone gel. So anyway, I hope that gives you some real information that's scientific and helps you understand the procedure better. Thanks. This shows a quick recovery breast augmentation patient doing her arm exercises after an axillary breast augmentation 24 hours post-operatively in our clinic.